Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about understanding medical record documentation language. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. Okay, so let's get started. All right. Now, this video was inspired by a viewer who made a comment on one of the videos, and she said that sometimes she notices that the providers will use very vague language when they are listing the condition that the patient has, or sometimes they'll put too much detail. Okay, and she's looking for all of the words, and she's looking for all of this detail, and sometimes she just can't find it. So one of the diagnosis in question was juvenile idiopathic arthritis. She says, it's not there in the book. I looked. Okay. What idiopathic means is that it's of unknown origin. Okay. Yes, there are some conditions where idiopathic is in the name, but juvenile arthritis is not one of them. Okay. You can find it under juvenile arthritis or arthritis juvenile. Okay. So idiopathic is just one word that the provider happened to throw in there, just saying that they don't know where this juvenile arthritis is originating from. They don't know where it's coming from or how it happened. They don't know, okay? So that is basically what he was saying there, or she was saying there. It's very important to recognize those supplementary words like idiopathic. And the reason that this is very important is because it can throw you off if you are trying to look up these diagnoses and you're thinking, gosh, it's just not here. If you get to a point where you get stuck like that, I strongly recommend that you put into the internet search for whatever condition it is that you're trying to find that you can't find in the book, okay? But after a while, when you are a medical coder for a longer period of time, you will start to spot those extra words that are sometimes used in conjunction with, but don't really apply, like chronic osteoarthritis. Obviously, if you look up osteoarthritis, you're not going to see chronic osteoarthritis. It doesn't mean that the patient doesn't have it. It just means that the provider is saying that the patient has had ongoing osteoarthritis. That's why they say chronic. But there is no specific diagnosis code for chronic osteoarthritis. Okay, so that is one of those words. But chronic is also important because sometimes if they have chronic pain, that is a diagnosis all by itself. But you have to make sure that the provider is actually saying that the patient has chronic pain or the condition, or if it's just because it's just right now and that the patient is acutely feeling this pain. There is a huge difference. So really understanding the language of the documentation, but really working with your provider to make sure that they understand what we see when we're as medical coders. What are we seeing? Okay, whenever we see history, right? I talked about this yesterday. Whenever we see history, we're thinking this condition is gone. It's bye-bye. It's no longer there. But sometimes providers will say that it is a history. The patient has a history of diabetes. They have a history of hypertension and chronic kidney disease or hyperlipidemia, things like that, because they have a history of it. That is their history. But we see that as past tense. So this is why if the patient is actively being treated for something, or if they have an ongoing condition like this, that you should really work with the provider so that they don't continue saying those words, that they're very clear. The patient's present conditions, X, Y, and Z, okay? That way it can just be very clear and straight to the point, all right? And another thing that I was wanting to bring up as well, when you have conditions like that, those chronic conditions, if they're being treated, if they're impacting the care of that patient, these are things that need to be in the documentation, okay? But if they have conditions that have resolved, you're not looking to pick those up on the outpatient side, okay? Resolved, it means it's gone. And then if it's a history, there's a history code for it. Say, for example, UTIs. There is a history code for UTI. But there's also if you try to look up recurrent UTI, it comes up to UTI unspecified. And so those are things that it's important to know, because you can get two different codes, right? You can get a Z code, which is a history of code, or you can get an actual diagnosis code, okay? So when you're trying to really understand these things, and other words like consistent with, of course, if you're coding on the outpatient side, this is only talking about the outpatient side, guys, not the inpatient side. Outpatient, we have to go with what's definitive, okay? And if we don't have a definitive diagnosis, then we're going to go with the symptoms. Understanding the pathophysiology is really going to help you there, okay? But when a provider says this patient has had an injury that is consistent with a sprain, it doesn't necessarily mean that that's what the patient has. So if we see something like that, then we're going to know that we're going to choose the injury unspecified of whatever body part, okay? Because we can't use anything that says consistent with. It's going to immediately cancel it out, okay? So them using that consistent with the sprain cancels out that diagnosis. That's something that they have to be counseled on if the providers are doing that on a regular basis. And if they're telling you, well, consistent means that the patient has it, for us, that is a key word that says that this is an unsure diagnosis. We can't use this. This is not definitive, okay? The only thing in this situation that would be definitive would be the injury unspecified code, because of that particular body part, because that sprain is there, it's consistent with. We don't know if it is or if it isn't. And if you read the ICD-10 guidelines, the diagnosis guidelines, it will really help you. It will really help you. And I put it in the community tab before, but I'll probably do another link again. I'll go ahead and link the ICD-10 coding guidelines. So if you don't have your book, you can reference these. It's straight from the source, okay? So I will go ahead and post those in the community tab again. But I just want you guys to be aware that there's going to be times when a provider is going to write extra words like that. And yes, there are some conditions that do incorporate idiopathic into the name, but not all of them. And clearly, juvenile arthritis is not one of them. Okay, but it doesn't necessarily mean that's not what the patient has. Okay, so in this situation, the patient does have juvenile arthritis. They just don't know where it's coming from. Okay, so knowing those things, understanding that is really going to help you. This is why I tell you guys to read anything and everything you can get your hands on. And especially when it comes to whatever your clinic specialty is, whatever your specialty happens to be, it's very important to read everything that you can. Only because when you are reading, it's going to help you to better understand things like this. This is not going to even be a question if you see a provider that writes something like that, like idiopathic juvenile arthritis. You're going to know that the provider is saying that he doesn't know where this arthritis is coming from. If you try to look up certain conditions in the ICD-10 book, there's going to be times when you're not going to find it, okay? Like Lisfranc fracture, okay? A lot of times at the beginning of sports season, we'll see this a lot in the ortho clinic, a Lisfranc fracture. I was very frustrated the first time I looked at it. I was like, how do I find this? It's not there. Lisfranc fracture comes up to a dislocation. That's how we know, because of the way that the injury happens, right? It's in the midfoot, and they call it a Lisfranc fracture, but it's actually a dislocation because the bone isn't actually broken. It's out of the place that it's supposed to be. So that's why it's called dislocation, okay? Or that's why you find it under dislocation, okay? Because if you look it up, it's not there. Also, skin eruption. If a provider writes skin eruption in their documentation and you try to look up skin eruption in the book, you're not going to find it. It's going to be found under rash, okay? That's another one. And really, I mean, eruption means like, you know, so think about that with the skin. And what does a rash look like? Something like that. So that is how you have to think about it sometimes. But there's going to be times when they're going to use synonyms, right? That, you know, it does mean the same thing relatively, or you can look it up to make sure that it means similar, okay? But I always recommend using the Optum 360 coder desk reference for diagnoses. That's very helpful. If you get stuck on a diagnosis and you happen to pull a diagnosis and you're not really sure, you can look in that coder desk reference for diagnoses, and it will give you the layman's explanation for it. That's why I always find those Optum 360 books very helpful. This is not an ad for Optum 360, but it's what I recommend. Optum 360 is totally what I recommend. I trust their books. I use their books all the time. But that is something that you have to look into. It's about knowing where to find your good references and good resources. And Optum 360 is just one, at least to me. And another one is vasovagal response. If you're trying to look up vasovagal response in the ICD-10 book, it's not going to be there. It comes up under vasovagal attack. So it's meaning the same thing, but if the provider writes response, the book is going to mean it as attack, a vasovagal attack, okay? And sometimes when you see things like smoking, there is actually a coding clinic out about smoking. If the provider documents smoking and doesn't say anything else that the patient is a smoker, you can't just assume that smoker means, cigarettes or vape. That's when you would use that F17200, which is tobacco dependence unspecified. So, or the type is unspecified because smoker does not necessarily mean cigarettes. It could also mean cigars. It could mean vape. It could mean all these other things, even though a patient who does vape is going to say they do vape, but let's see what else. What else do I have? Oh, so, and then the history of was another thing that I wanted to talk about. So when, and I mentioned this before, if we see history, we're thinking that this condition no longer exists. This is part of what you're supposed to do as a coder. And not all coders will do this, but it is clinical documentation improvement to do it, okay? So when you are speaking with your providers, letting them know that when we see history, that we equate that with that the fact that the patient does no longer have that condition, okay? That's something that's already been resolved. But if they have an ongoing condition and the provider says the patient has a history of, we need to be very clear. Is this an active condition? Okay, so you want to get them to develop really good habits when they're documenting their patient's conditions. Okay, if they are having present conditions, you can have them put present conditions or patient's conditions. If they have something that has been resolved, then you could put they had a DVT. It is resolved as of 2019 and is no longer on medications. Okay, then we know that the patient has a history of a DVT. If this is pertinent, then we would pick it up. We would pick up the history of code. So, but yes, that was my points that I wanted to make today. But I hope that this does help you. If you're brand new and this is your first job in medical coding and you're still trying to learn your way around these little quirks, it's going to take some time. Don't be impatient with yourself, whatever you do, okay? So just be patient and know that it is going to take you to do some continual education on yourself and read so that you know and understand these extra words that come into play, okay? It won't always be confusing. You will get to a point where it gets a lot easier, but knowing that you can use other references to look stuff up is really going to help you, okay? So that's my show for tonight. I know it's short and sweet, but that's pretty much all I had to say on this one. So I will go ahead and wrap this one up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.